Hi, I'm Dr. Wooten. I'm a board-certified plastic surgeon practicing in Pittsburgh, Pennsylvania. I have been performing fat grafting for a long time, and I love doing this procedure. Fat grafting is a safe procedure where we take the fat from an unwanted area like the flanks, abdomen, inner and outer thighs, and place it in either the breasts, buttocks, face, and other parts of the body. I feel like a sculptor when I chisel out extra fat from undesired areas and graft it into deficient areas of the body. It takes specialized skills and dedication to get consistently nice results from fat. It takes time and effort to create beautiful results. And no, we cannot use fat from other people, only a patient's own fat for this procedure. Who is an ideal candidate for the fat grafting procedure? The best candidates are patients who already love the shape of their breasts but would like them to be bigger and who also have some extra fat to spare. On average, I see 1 cup size increase with one procedure and 2 or more cup sizes with 2 or more fat grafting surgeries. Some women may opt for multiple fat grafting procedures. Very active and lean patients may not be good candidates for this procedure since their fat melts away as they get leaner. Does the fat last? Yes, fat lasts. When we borrow a fat cell from one part of the body and place it in the other, roughly 80% of fat cells stay and they retain their quality of fat of the donor side. When I look for a place to take the fat from, I harvest it from the areas where are more resistant to weight loss. If a patient loses weight, fat cells get skinny and shrink. If a patient gains weight, fat cells get chubby and grow in size. With traditional fat grafting, about 20 to 30% of fat cells gets reabsorbed and get excreted by the body during the immediate months after surgery, and the rest is retained for a long term. With the latest technology, the fat reabsorption rate is much lower, giving the patient a fuller and more stable result. I recommend that patients maintain their weight and avoid fluctuating, as that can change the overall result. What are the risks and limitations of fat grafting? Well, the main limitation of fat grafting is the amount of fat that can be placed in one procedure. Depending on the patient's goal with how much bigger they would like to go, they may require multiple procedures to get to the size that they're looking for. Those procedures can be performed as close as 6 months apart or as far apart as patient wants to, whenever patient is ready. If a patient is looking to increase their cup size by 2 or more sizes up, and they want to do this all-in-one surgery, and they also want to achieve a lot of fullness at the top of the breast, maybe they're better candidates for breast implant procedure, which can also be combined with fat grafting. Risk of oil cysts or fat necrosis are very uncommon in my practice. I think that surgeon experience and technique really matters, especially when it comes to fat transfers. This procedure will not be compromising your annual mammogram or breast cancer screening. During your consultation, I examine your breast, but also I will examine the donor sites. I carefully assess the patient's skin quality in the donor areas before I take the fat. We don't want to have any grooves or divots at the donor site, and we also don't want to have loose skin there. During surgery, I take the fat out of the donor site via liposuction process. And then I process on the back table, and then I re-inject the fat into the breast. Harvesting the fat, as well as seeding the fat cells throughout the entire chest wall, takes time. The surgery takes approximately 3 hours. What to expect from your recovery? Well, with this procedure, there is no specific activity or lifting restrictions. However, we do typically recommend taking a week off to get back to desk job. I recommend avoiding excessive activity for about 4 to 6 weeks to allow the donor sides to heal. Patients wear compression for 6 weeks after surgery to ensure the areas where liposuction was performed heals well. Looking at my website results will give someone a good idea how one might look after one or more procedures. Meeting for an evaluation in person is essential to evaluate the donor side as well as the tissue quality. We will discuss your goals and create a plan. Thank you for your attention.